In other world news, an AIDS patient is apparently free of HIV after receiving a bone marrow transplant during leukemia treatment. He received stem cells from a donor with genetic mutation, making him immune to HIV.
These German doctors have witnessed what could be a medical breakthrough. They've been treating a leukemia patient at the Benjamin Franklin Clinic in Berlin, and part of the therapy was a bone marrow transplant. But the man, a 42-year-old American living in the German capital, also has AIDS. After receiving the transplant, amazingly it seems he's no longer HIV positive, a story that's made front-page news in Germany. Dr. Gero Hütter, who's a leukemia specialist, is the doctor who treated him. He replaced the patient's bone marrow cells with stem cells from a donor who has a genetic mutation that prevents them catching HIV, the virus that causes AIDS.
The
treatment, the stem cell transplant, was carried out to treat the leukemia and not to treat the HIV infection. If you like, that was a side effect. We would have carried out the stem cell transplant anyway, even if we hadn't found a suitable donor with the mutation.
The patient hasn't taken antiretroviral AIDS drugs for almost 2 years. But the doctors still haven't been able to detect HIV in his blood. But the unusual medical side effect of this case won't change treatment for HIV sufferers.
This is because the therapy has such a high mortality rate that it can't be justified ethically other than in this special situation where the patient has to have a transplant due to another illness. I say this in order to reduce false hopes.
Doctors are still a long way from finding a cure for AIDS, and this case doesn't change that. But it's hoped this discovery could open up new avenues of research as scientists work towards finding a way to tackle HIV.